Welcome for day 15 of the challenge. And today I'm going to talk about the subject which is not so fun to talk about. And it's about a message that I received from a lady who said that her dog has cancer. Now, there is a lot to say about cancer, and I will be talking about this more later on because I also got another email where somebody wanted to have more information about tumors in horses. But tonight I'm going to concentrate on cancer in dogs because that was the question that the lady sent to me. And her dog has a very big tumor in the liver and it was not operable. And the vet had suggested to do chemotherapy. And she wanted my advice. Now, I'm sorry, it's a bit dark here, but it just started to drizzle a bit here in Spain. So I just went under my terrace. Oh, and there is one of the rescue cats arriving. And you see some of the stuff for the rescue chickens in the back and the outdoor kitchen. But I'm here tonight to talk about cancer. First of all, whatever disease your animal has, make sure you always have a diagnosis from your vet. That's the first rule with everything, because some tumors that you can find on your animal are benign and you should not be worrying yourself sick for those. But it's always good to go to your vet first and to know and to find out what's going on. In this case, this dog cannot be saved. The only thing we can do is either give him give him chemotherapy, and that was what the vet offered to this lady to prolong the life of this dog. Now, chemotherapy is one thing. I think that what you are feeding your dog is another thing. So I would always remind you to check out the work of Dr. Karen Becker and see what she is saying about feeding your dog about this. And of course you have the dog cancer series, which you shouldn't forget. I have them even myself, I have them here. So make sure to consult them. But on the other hand, there is a choice you have to make. And I will just talk to you right now about the choice that I had to make, because I've had a dog, Pino, who was a border collie, and he had also a liver tumor, and it was no option anymore to cut that part of the liver out. And because, as you know, the liver does renew itself in some part. So for a liver, most of the time it's easier to deal with that. But in this case, it was not possible anymore. And the dog was really old. Now, I did make the choice to not use chemotherapy because it would prolong his life for a few months, maybe. And all the side effects you don't know. There are some side effects that you can deal with photonic therapy. And for example, there would be any nausea the dog would have. And how do you know he is nauseous? Well, if you don't have a close contact with the animal, so you don't feel it intuitively what the dog is feeling, you would see it, for example, when he refuses to eat, when he's just not himself. Often of the time it's a sign of being nauseous. And yes, all these signs you can take care of with the torch. Now, in my case with my dog Pino, who died a few years ago, I made the choice to make his life the best that could be for the rest of his life. That means I would torch his standard points to stimulate his immune system. And I would torch anywhere the dog would be in pain. So Pino did have some arthritis sometimes, so I would torch for that. He was an old dog, so he had his little things, and I would take care of those. And with doing that, I would make sure that whatever life he had left, he would spend it doing what he loved most. and that was running around with me, going on the land, going to get the horses, bringing the horses home. At that time, we had 11 horses, and I had 11 horses, and I still have the cat coming. Come, Baloo. Hold on. Let me help you. Baloo, come. Here? Okay. Oh, she's sitting there. Come on. Come here. Okay. Let's... Baloo. Okay. Jumping around again. Anyway, so at that time, I chose to give my dog the best life he could have while still being alive, although he had this cancer. And that was by taking this pain away and making sure that he would feel the best he could feel. And when he told me it was enough, I contacted the vet and I told the vet, this is enough. So make sure, it has nothing to do with photonic therapy, but make sure that you always listen to the wishes of your animal. And if the quality of his life is not the quality that he deserves, then please be there. Be there for him. Make his last days the best he can be. Give him whatever he wants to eat. Make a feast out of them, of those days. I mean, out of those last few days, and be there for your animal. One thing I have done is I have spent afternoons at vets' practices, being the one who is there for animals who have to be put asleep, where the owner has just dumped. I'm sorry, I may be cruel saying this like this, but it's the fact like it is. They dumped the animal at the vets because they weren't there when the animal had to be put to sleep. So I would be there, and I would be there so the animal would not be alone, and he would get some warmth and attention in his last moments before transitioning into another phase and getting the chance to transition in another phase. So please listen to your animals. Make sure you always make the choice that is best for them, not for you. I know it hurts, but please make sure you always choose the best for your animal and not for you. If their time has come, please let them go. Don't leave them at home suffering until their time would come with no help. I'm quite tough in these kinds of things, and my real character comes out. I do have my vet normally come home to my place for that final stage, and that's also because then my other animals can smell and see what has been going on and what's going on, and they can say their goodbyes. Okay? Photonic therapy can help your pet in need at that moment. For the one who has to transition, by taking the pain away and making sure that everything happens painless. And photonic therapy at that time can also help those who stay behind. Because I promise you, they know, and you don't want to hear them cry. I luckily have never had that problem at my place because I've always been there for the others, animals. But in case that's not the case, I have heard stories that are really cruel of animals looking for weeks after their friends because he wasn't home to die, or the vet didn't come home to put him to sleep, or they didn't bring him home later on. Okay, if you run a rescue center like I do, you see everything. And I think I can say, I'm sorry, it's getting really dark, but I can really say I think everybody who has been here has been lucky, because I've always been very in contact with any of the animals here. And the only ones that have been put to sleep were those who were at the end of their lives and told me, it's enough, let me go. So I helped them with my vet. Okay, so just have a look again from the start. You can use photonic therapy. You cannot always heal the animal when it's too late. It's just too late. When their time has come, their time has come. But you can help them with the pain they still have to remove that and make them be calm to transition. And you can still use the photonic therapy later on for all the others who are staying behind. You can help them on the mental base and on the physical base. Okay? I'm going to say good night. It's almost dark over here in Spain. Bye-bye. Please continue to send me your questions. And if you like the videos that I'm making, make sure to like them. Please leave a comment and please leave me your questions. So I have material and I will keep on making these videos. Okay? Bye-bye.